On this channel, you will learn a lot about the intestine. Everything you need to know about the intestine that doctors may not tell you. The intestine is a long, coiled tube that forms part of the digestive system. It plays a vital role in digestion, absorption of important nutrients from food, and elimination of waste from the body. The large intestine is composed of 4 parts: the cecum, colon, rectum, and anus. It is responsible for absorbing water, electrolytes, and vitamins from ingested food, as well as producing and secreting hormones. It also plays a role in immune system regulation, by protecting the body from toxins, bacteria, and other harmful substances. The healthy functioning of the intestine is essential for the overall health of an individual. The small intestine is roughly 9 to 16 feet long, while the large intestine is shorter, measuring around 5 feet long. The small intestine trusted source is actually longer trusted source than the large intestine but gets its name from its smaller diameter. It is located toward the bottom of the abdomen and connects the stomach to the large intestine. The small intestine makes digestive juice to complete the breakdown of food. It also absorbs water and nutrients trusted source. If the small intestine is unable to absorb enough water, a person may get diarrhea. The small intestine consists of 3 distinct parts. Duodenum. The duodenum is the first and shortest trusted source portion of the small intestine. It completes the first part of digestion by mixing enzymes from the stomach and pancreas to break down food further. Jejunum. The walls of the jejunum trusted source help absorb nutrients from food, using tiny hairs called villi. The walls also include circular folds called plicae-circulars. These increase the total surface area of this portion of the small intestine, helping it effectively absorb nutrients. Ileum. The ileum helps absorb any remaining nutrients before food moves to the large intestine. It plays a key role in absorbing vitamin B12 and bile acids. It is also the longest trusted source section of the small intestine. How long is the small intestine? It is difficult to measure the length of the small intestine in a healthy living person, but researchers estimate that it ranges from about 9.8 feet to 16.4 feet. The 3 sections of the small intestine differ significantly trusted source in length. The duodenum is about 7.9 to 9.8 inches in. The jejunum is about 8.2 feet long. The ileum is close to 9.8 feet long. Older research trusted source found that the total length of the intestines correlates with weight, such that people who weigh more have longer intestines. Younger people and males also have, on average, longer intestines. The small intestine is long enough that a person can undergo small bowel resection trusted source surgery to remove part of it if an underlying disease or condition causes it to stop functioning. What is the large intestine? The large intestine trusted source, which doctors also call the colon, has a larger diameter than the small intestine. The primary function trusted source of the large intestine is to reabsorb fluids, electrolytes, and vitamins and then form and propel feces toward the rectum for elimination. It contains 4 distinct trusted source parts. Cecum, also known as the ileocecal junction, this section joins the intestines. The cecum helps absorb water and any remaining salts. Colon, the colon, the longest portion of the large intestine, is a segmented portion that absorbs more water and electrolytes. Rectum, the rectum stores feces after digestion. Anal canal, the anus is the final portion of the large intestine, and it helps a person have bowel movements. Various health issues can affect the intestines. For example, a person may develop constipation. Constipation involves the GI tract struggling to pass stool. It may result from a low fiber or fluid intake, hormonal imbalances, or a lack of mobility. Constipation can also be a side effect of medication. It is more common trusted source in older people than younger people. Eating more fiber, drinking plenty of fluids, and getting regular exercise may help ease constipation. A person might also try over-the-counter fiber supplements and laxatives. Viral gastroenteritis. Viral gastroenteritis is also called the stomach flu. It results from an infection and can cause cramps, watery diarrhea, nausea, vomiting, and a fever. The symptoms may last from a few days to 10 days. The stomach flu accounts for 19 to 21 million trusted source cases of diarrheal illness annually in the United States. The key is to maintain hydration and replace electrolytes. To address specific symptoms, such as diarrhea, over-the-counter medications, such as loperamide, Imodium, can help. Irritable bowel syndrome. This condition, usually called IBS, is characterized by abdominal pain, bloating, and changes in bowel habits. It affects around 25 to 45 million people in the U.S. The exact cause is unknown, but the authors of one review observe that specific bacteria tend to be associated with it. The right treatment depends on the person's symptoms, but the results of a 2019 review suggest that a holistic approach, including personalized probiotic therapy and diet modifications, may be best. Celiac disease. Over time, in a person with celiac disease, the gluten in wheat damages trusted source the small intestine so that it no longer absorbs nutrients as efficiently. Symptoms vary, from diarrhea and abdominal pain to irritability and depression. Adopting a gluten-free diet is a key element of treatment. Crohn's disease. Crohn's disease causes chronic inflammation in the GI tract. It most commonly affects the end of the small intestine and the juncture with the large intestine. Because the symptoms of this inflammation also stem from many other health issues, a doctor may refer the person to a specialist, called a gastroenterologist, for further testing and a diagnosis. The frequency and severity of symptoms can vary from person to person. Treatment involves taking medication, including biologic therapies. Ulcerative colitis. Ulcerative colitis causes inflammation, ulcers, and scarring of the large intestine. Symptoms include trusted source cramp-like abdominal pain and an urgent need to have a bowel movement. To address flare-ups of symptoms, a doctor may prescribe medications, aminosalicylates, corticosteroids, or immunosuppressants. If the symptoms are severe and not responding well to medication, the doctor may recommend surgery. A variety of tests can detect colorectal cancer, including a colonoscopy, a CT scan, and a biopsy. Most early forms of the cancer cause no symptoms, so screening and early intervention are crucial. Symptoms of colorectal cancer include diarrhea or constipation, blood in stool, making it look black, bleeding from the rectum, a feeling of fullness, pain, or bloating in the abdomen, fatigue, unexplained weight loss. The most common treatment is surgery, though the advisability of this depends on the tumor's size and location and on the stage of the cancer. Prevention. Not all intestine-related health problems are preventable, but there are several ways to look after the gut, including eating a healthful diet that is rich in protein, fiber, and complex carbohydrates. Staying hydrated. Managing stress levels. Quitting smoking and avoiding secondhand smoke. When to see a doctor. If stomach or gut pain lasts for more than a few days and does not ease with home care, contact a doctor. Also, a person should receive medical attention if they have a flare-up of symptoms of a known health issue, a loss of appetite combined with tiredness and fatigue, blood in stool, intense, severe pain that lasts hours. Takeaway. Keeping the intestines healthy is crucial, and researchers continue to find new ways of treating related illnesses. It is important to be aware of warning signs, such as bloody stool. Overall, anyone who has a concern about their gut health should consult a doctor.